history, history is recall history. That is a diabetes already diagnosed child, diabetes mellitus with weight
Yeah,
loss,
yes.
and the child is Ali. Ali is a 15-year-old child, and his mother is a Fatima. You have to take the history from Fatima. Okay, clear?
Yes. So I need, to take the history now, or you are going to do the approach.
Yeah, you have to go. You have to take the history now, and so you take time, or you want to start?
Okay. Uh, Fatima, mother of Ali.
Hmm. Ali
Ali
is
is
already diagnosed case of diabetes mellitus, but he has recent weight loss. That is the main concern.
okay.
Okay, you start.
How old is Ali?
Ali is 15 years age old.
15. Good morning.
Good morning.
Uh, this is Dr. Salah, from one of the children doctor in the hospital. Uh, so Ali was referred, or by his GP, or what's
Yeah,
going on
Ali
here,
was
Ali?
referred by the GP.
Oh, yeah. I must be talking to Miss Fatima, mother of Ali.
Yes, Dr. I'm Fatima. Ali is my child.
Yeah, nice to meet you, Miss Fatima. Miss Fatima, today I'm here just to discuss the referral from your GP about Ali, about his. There's like concern about his weight. Uh, uh, is that okay?
Yes, okay.
Okay, thank you, Miss Fatima. Yes, Miss Fatima. What is your main concern?
Actually, doctor, what happened? Ali is my child. He's 15 years age old. He's giving me a headache. Like, mommy, I'm losing weight. I'm losing weight. But I'm not saying that he's losing weight. So I'm here today because of Ali.
Yeah, yeah, I can see. Yeah, Dr. Fatima, sorry, Miss Fatima. Just let me to go back. I mean, Ali was like it's me mentioned that he was diagnosed with diabetes. And can you tell me a little bit more? When was that, and when was
Yeah,
that?
when actually I forgot. I think, oh yeah, I remember. That is when he was 10 years age old. He was diagnosed with diabetes
Okay, and do you remember by whom he was diagnosed?
by doctor. We have visited a doctor. The doctor diagnosed him. He's diabetic.
Okay, and did he need an admission at that time?
Yeah, of course. That time, he developed something decay type, and the time that's diabetes developed.
Okay, and he was admitted. I mean, to like in the hospital in
Yes.
clinical or in ICU?
Yeah. He admitted in the hospitals. Yeah, I remember now.
Yeah, intensive care unit. He was admitted in intensive care unit.
Yeah, I forgot. He
Oh,
admitted on the hospital. I remembered.
in the hospital. Okay, and did he need? Do you remember what I mean? After like, how long did he stay in the hospital? I mean, for during the admission.
I forgot, doctor. That was a long time ago, and I forgot everything.
Okay, and during this time, I mean, they gave you like they gave you he was given like medication like insulin. Is that right?
I don't know what time that time what they given him not, but now he take insulin. What I know. Yes,
Okay,
he's taking insulin.
how many doses of insulin he's taking?
Doctor, he's
How
15
many?
years age old. I don't know. Yeah, he's
Oh,
taking his insulin. I don't know.
okay. If you don't mind, I mean, can I speak to Ali about that?
No, Ali is not here. Here only I am.
Okay, all right. Okay. And Ms. Fatima, do you think, I mean, Ali has missed like any dose of insulin? Is he like, has he reported that he missed any dose of insulin?
I don't know. He's taking insulin. I don't know. He's a 15 years age old. He can take care of himself.
Okay, okay. Okay. So, Ms. Fatima, let me just ask you a few questions about any fever, any weight, apart from the weight loss, any fever, Ali, does he have?
No, he has no any fever. I don't think.
No fever. Okay. What about his appetite? Are you satisfied about his appetite? I mean, does he like uh, eat his regular meal?
Yeah, he's taking
Okay.
his meal. He's 15 years age old. He's going
Okay.
outside. He's taking all the meals.
Okay. Any change in his behavior? Have you noticed that? I mean, any change in his behavior?
No, his behavior not any changes.
No change in his behavior. Okay. Any cough? Any like chest complaint in his chest?
No, I don't
Oh,
notice any
oh,
cough or chest complaints.
okay. Any vomiting? Any diarrhea, constipation?
No diarrhea, constipation. But in nighttime, I think 2 or 3 times he go on the toilet, and he on the light, and that's really disturbing and rude.
Okay. Does he drink lots of fluids?
Hmm?
Does he like drink? Does he like ask for? Have you noticed that he's drinking lots of fluids as well?
Alcohol, I
Like,
think he take because once he has come back from outside, and I noticed that some alcohol smell from his mouth.
so okay. Okay. And how often did you notice that? I mean, only once or many times?
Only once I noted. I have no time to notice him. You
Okay.
know.
Oh, yeah. Okay. Okay. So you said that he was admitted to the hospital for the DKA. Do you remember like any more any further admission did he need
No,
for the same?
I
No.
don't think any admission needed him.
Okay. Who does he check? I mean, his blood glucose, blood sugar regularly. Have you noticed that?
I can't say that. I don't know actually.
Okay. Okay. So do you have an idea about like the results of his diary for like the checking of blood glucose and ketones
I
and all of
don't.
these?
No,
You don't know.
I don't know.
Okay. Okay. Okay, mom. So who do you live with mom in the house?
I don't get.
Is there anybody else live with any? Okay, sorry. Let me just to ask about any history of allergy, any products like.
No, I don't think he has any history of allergy.
Okay, and okay, and like let us go back. I mean, to his like when he was actually when he was born. Any issues during after birth?
Actually, really disturbing. He was my first child. I wasn't pregnant. I went to abort him. I was only 17 years old, but I can't that.
You were 17 years old. Okay. Okay, mom. What about like? So, how is your relation with Ali?
What
How do
is
you
you
feel like?
asking? He is now 15 years old. He's okay. I have 7 kids. I have to take care of them. So it's not possible to me. The only Ali taking, and he's grown up.
Okay, he's grown up. Yeah. Yeah, I can see. Okay, mom. So, what else should I ask? Okay. So, apart from like alcohol, I mean, have you noticed that he's using any other sort of drug, like you know,
I,
cannabis
I,
or
I have not noticed. He never sharing all this stuff with me.
what about smoking?
I don't know. Maybe smoking outside.
Maybe, maybe smoking outside. Okay. Okay. How is his performance in the school?
Yeah, okay, going. I think he's just passing his exam.
Oh, okay, he's doing well in the school, like in
Mm.
subjects and all subjects like math and all of this.
Actually, Doctor, I
Yeah.
have 7 kids, so noticing him especially, I have not the
Okay.
time.
Okay. Okay. Did he
9
like
minutes.
have any? Okay. Okay. So okay. Did he have any sort of hypo like record of hypos? I mean, have you checked like when he checking blood glucose? I mean, have you noticed any like
No,
lost hair? No.
no, no.
Okay. 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 So you said that the color he's passing urine more frequently. Any change in the color of his urine or smell
No,
of his?
no, I don't
Okay.
notice anything in urine.
Okay. Okay. Any abnormal movements like or have you noticed that like or weakness? I mean, his muscles.
Yes?
Any abnormal movements? Have you noticed any abnormal movements?
No, he
Uh,
has no any abnormal movement.
no abnormal. Okay. Okay. So now I'd like just I mean to summarize so far what you have mentioned, ma'am. You said that Ali he's like now he's complaining of going to Ali he's got like he was diagnosed with diabetes when he was 10 years old and he was admitted at that time for the case of DKA. Now Ali he's like he's complaining of like passing urine more frequently, going to toilet during the night time, and Ali at the same time like you have no idea about like his blood results for the sugar. Ali, like you notice that Ali he's drinking alcohol, and there's no like definite issue about the smoking, but as I said, he might be smoking. Okay, and yeah.
What is
So
your diagnosis?
sorry,
What is your diagnosis?
my diagnosis is like uncontrolled diabetes. Maybe like because of the smoking,
Hmm.
because of drinking alcohol. Uh, so uh, so the diabetes is
Okay,
not controlled. Yeah,
okay. So first of all, your chief complaints was diabetes mellitus with weight loss. Okay.
weight loss. Yeah,
So
diabetes. Yeah,
at
weight
the
loss.
beginning, you have to keep in your mind. There's some differential diagnosis on my mind. Diabetes mellitus, autoimmune disease. Here, the weight loss cause can be why. It can be non-compliance with the treatment. It can be due to his anorexia nervosa. He's not taking food. It can be with any celiac disease, any hyperthyroidism, anything. Okay. So that is on the present illness. You ask me everything about diabetics, how he diagnosed, any admission needed. That is you. But you have never asked me about weight. That how many kg he has lost weight. How can you check this lose weight? Like any loose dress, you measure how much weight he has lost. That is very important. You have to ask me. Okay, that is on the
Yeah. Okay.
present you miss. And after that, you will go on the general fever, his activity. How is his activity? Okay, appetite. You ask on the systemic review. Actually, it was like haphazard. Then CNS, we go the CVS, we go the respiratory, endocrine, any hot or cold intolerance, any sort. These are then urine and GIT, poo condition. You have not asked me the poo, any tummy pain, tummy size. Here the answer is that he is the celiac disease. Okay. So if you ask me about how poo conditions and is that it is flashable or not flashable, then I will tell you these conditions. Any
Yeah,
tummy size, any buttock muscle wasted or not, you have asked me, then I will give the answers. Past history you have taken, past any admission needed or not, any trauma, any surgery, any traveling. Okay, these are not needed actually here, trauma, traveling, but you can ask. Then puberty's history you have not asked. He's 15 years age old. It's needed. That he is starting men look like. That is birth history. You ask. Birth history was like I have 7 children and he's my first child. I want to abort him. I tell you. Development you ask maybe. Vaccination not ask. Allergy ask. Family, social, psychological. Okay. So lots of point you miss. Here the cause is actually celiac disease. Okay. And others you are telling that he has not taken insulin properly. Actually, I don't know. Her negligence is one of the important cause. Her mother is very much negligent. She want to abort the child. She is not interested. She has 7 children. Do you understand?
yeah. You are right.
So that is the history. Okay. So how can you manage this patient?
I will involve a multidisciplinary team. First of all, I would like them to take to do after taking the history. I would like to do full general examination with more focus on his abdomen and his like endocrine system. After that, I would like to involve a multidisciplinary team involving the diabetic on the top of that involving my consultant, diabetic team, endocrinologist, gastroenterologist, and yes, I would like to ophthalmologist to check his eyes because he's 14 years old now.
Social worker, because her negligence is one of the important. I will
Yeah,
go
social,
social worker. Mm.
yeah,
Lies
social
with the
worker.
school. Lies with the school.
Yeah, liaise to the school
You have not asked.
and
Okay. Mm. So I will
psychologist
give
as
you
well.
my notes. I will check the vitals. I will assess the patient has decay or not. Then measure his blood glucose level, full blood count. That is involve the multidisciplinary team. That is gland doctor, pediatrician, an endocrinologist, diabetic nurse, dietitian, and social worker. Involve psychologist. I will involve ophthalmology involved for follow up. Lies with the school nurse and teachers. So according to, if the test is positive, then go for the endocrinology and celiac disease management. So when any history we take, first the chief complaints, when we know the chief complaints, some differential diagnosis will come on our mind. What is the reason of a diabetic child with weight loss? That is, can be celiac disease is an important cause. Hyperthyroidism, an important cause. He has Addison's disease, important cause. He has non-compliance with the treatment, important cause. So 4 or 5 cause. According to, we'll ask. First, the analysis the chief complaints like weight loss. You can analysis and his diabetics. Okay, analysis that. After that, by system wise we'll go. Endocrine, you can ask like hot or cold intolerance, anything from CBS, any racing heartbeat, any tremor you feel, hyperthyroidism you are excluding, any palpitation you feel or not. Then on GIT, you tummy size. How about his poo details? You take the poo history. Is that flashable the poo? That you can ask. So that easily it exclude. If we systematically we go systematically you go, we can exclude that. And here mother actually not giving you the important the informations because mother is here negligency. Okay, neglecting this child. Okay, doctor.
Yeah, doctor.
Okay, so thank you very much for your participation. I think okay.
Thank you so much.
Okay, you're
Yeah,
most
thank you, Dr. Emma. Dr. Emma, are you going to like are you doing a session like
start eating.